Okay. Good morning, good afternoon, and good evening to everyone, and welcome to UCSF's Center for Global Nursing's Impact Series. As so many of you know, this series aims to provide a platform for our nurses and global partners to share their remarkable work and offer valuable insights and inspire our global community. Following today's presentation, there will be a short Q&A, so feel free to write your questions throughout the presentation in our Q&A box. For those of you that don't know me, my name's Rebecca Silvers. I'm the director of the UCSF Center for Global Nursing. And it is my biggest pleasure, my happiest part of my day, to introduce this month's speaker, Melesi'i Inu Ha'angana Filise. She is coming to us, zooming with us from the friendly islands of Tonga. Mele currently serves as the Chief Nursing Officer of the Ministry of Health in Tonga, where she leads the country's largest healthcare workforce and oversees national initiatives to strengthen nursing and midwifery services across Tonga. With more than 3 decades of experience, Mele is widely recognized for her leadership in advancing the quality, safety, and professional development of nurses across all levels of care. She's played a key role in pioneering advanced practice nursing in Tonga and in supporting the development of a new cadre of nurse educators who are currently participating in our collaborative quality improvement fellowship, where they are making important strides in improving health outcomes across the country. Prior to her current role, Mele spent more than a decade as a nursing lecturer at Queen Salote Institute of Nursing and Allied Health, where she helped shape curriculum and strengthen capacity for the next generation of Tongan nurses. A passionate advocate for nursing leadership, education, and workforce development, Mele continues to champion equitable access to high-quality care throughout Tonga and the Pacific region. Mele is a dear friend of mine and an incredible nurse leader, and we are honored to welcome her to this month's Global Nursing Impact Series. Mele, thank you so much for joining, and I hand it to you.
Thank you very much, Dr. Rebecca, and Maloi Lele, and good afternoon from Tonga, and good morning, good evening to wherever you are tuning in from. And firstly, I would like to acknowledge the presence of God. Tonga is a Christian country, and we would like to acknowledge knowing that He is present in every an inch of places we are, especially nurses. My name is Melesi'i Inu, as Rebecca has introduced, and I'm really, really happy to be here. And this is the first time that I'm in the series, and it's not in the middle of the night. So I'm happy to be here. So Rebecca, I'll start. Okay, so love to everyone. Please have questions if you are send question, and you can stop me in the middle of the presentation to ask if you want to. But this is the Kingdom of Tonga, and we are located in the South Pacific. And most of you might not know where Tonga is, but we are known for the friendly islands of Tonga, as we are happy and we are giggly people to be with. If you're not aware of where Tonga is, we're very close to Fiji, which has the highest tourist attraction, I believe, in the Pacific. So we're close to Fiji. We're also in 3 hours plane ride from New Zealand, and probably 4 from Australia. That's us. So here is where we are located. This is Tonga. And we also got smaller groups of islands apart from the main island where the headquarters for Ministry of Health is and where I'm located. This is our national shield and also our flag. If you see it coming around, especially with the rugby league, yeah, that's our country. Next slide, please. So for Tonga, the main island is Tongatapu, where I am, with a population of 75,000 population. There's also smaller islands, and in Tongatapu, that is where the main referral island is located. There are other smaller islands also habited and very much active, which is Vava'u, the second one to Tongatapu, Hapai, Ewa, Niua Toptapu, and Niua Fo'ou. The two newest, the Niua Toptapu and Niua Fo'ou, it's about half a day boat ride from main island. And I believe they are closer to Samoa than to Tonga. But hey, we still get to our islands no matter what. And this is Tonga's total population according to the statistics of 2025. 102,000 of population. These are people here in Tonga, but you might notice Tongans everywhere. And I believe our population outside of country is more than what we have here in country. Next slide, please. Coming down to the Ministry of Health, this is our generic structure for the Ministry of Health, where we have the Minister of Health, Honorable Sasovaleni, who was just appointed this year. But this minister, he's a son of a former head of section nurse. Our director is Dr. Reynold Wanoa, our CEO. He's a son of a doctor. And the Ministry of Health has 5 divisions. And nursing is one of the five division, which is under the leadership of myself and a lot of people who have supported me. The picture on the side is Dr. Amelia Fa'amangotu'ipulotu, the WHO CNO. I wanted to showcase Amelia, and that's how far Tonga can go from a very small island. We are in the head of WHO. So Amelia was our former CNO, and now she has moved to WHO, and I'm taking over her role. I specifically wanted even though Amelia might not approve her white picture, but I wanted to have that on because she was in her CNO nursing uniform. Thank you. So for Ministry of Health, as I have mentioned, there's one main hospital which is in the main island of Tongatapu, and we call that Viola Hospital, which has the largest workforce here in the main island because it's also the one main referral hospital. In the smaller remote island, there are also hospitals there and health centers. So here in the main island, there are 7 health centers, which has a workforce of nurses and health officers or NPs, nurse practitioner. And there are also 16 maternal clinics and child clinics, which only consist of a reproductive health nurse. And I will talk on how we are trying to improve on our clinics and our health centers related to the need of universal health coverage and our context here in the islands. Mind you that in Ha'apai Island, Vava'u, there is a main hospital within the islands, but there's also many, many scattered islands that a zone nurse is taking care, only one nurse is taking care of probably 5 to 6 scattered islands. So it's a bit rough for us here in the main, having a workforce that is all over the country. Next slide. And before I move on, this is a WHO CNO, and also our regional, Western Pacific Regional Director is also from Tonga. So Tonga has a good light of moving globally, I can see. Thank you. So this is the main hospital, and this is just part of, this is where, what in the picture that you see, that is our outpatient and part of our offices on top. There's 155 beds, and we have a different section for nurses. So for clinical nurses in our main hospital is 216, and this 216 included nurses who just completed December last year, and we have another lot coming in, hopefully in the next few months. And these on the sides, these are the unit or the wards that we have here in the main island. There's also sexual reproductive health nurses, and the NCD, they are the public health nurses for Tonga. So outside in the community, we have 2 cadre of nurses, which is the sexual reproductive health nurses who cater for the maternal and the child. And the NCD nurses cater for NCD related nursing only. So there's 62, there's 48, which we cater for the main hospital and also the health centers and the clinics. And there's also 4 nurse practitioners. And I wanted to highlight there's 5 still on training, which I'm praying very much they'll be coming back very soon. And on top, this is our uniform. A pink is a entry-level nurse, and the whites are progressing up to management. Next slide. This is Vava'u, our next main island. It's in the process of having a new hospital, which is funded by World Bank. But as you can see now, it has been there for ages. And nurses and doctors and health personnel are still making use of the facility. In that sense, as World Bank is trying to have the development up, it's the same time with us here having to put up the capacity. So when the hospital is coming up, there's already resources, human resources to cater for all. And this hospital is designated to be the second referral hospital if anything happens here for the main island. So for now, there's 50 capacity in beds. This is our number of nurses in the working here. And mind you, there's also scattered islands. So these numbers are small, and we are also scattering the nurses to the smaller, remoter islands. Thank you. So this is the next is Hapai, and Hapai was affected by our tsunami. So the picture you see on the top, it's the old hospital, and it's very close. It's at the shoreline, so it was actually affected by the tsunami, and they have relocated to the new one, which is the picture on the bottom. And this is the bed capacity is 26. Our clinical is 10. I wanted to highlight the reproductive and the NCD, which is only 11. But they have more than 10 islands scattered all around. So all we can do is have the NCD nurses located in the main hospital at Fuspala, and the reproductive health nurses who are in the islands are catering for all. All nurses role, all health personnel work is being done by one nurse who's looking after 6 remote islands population. Thank you. And this is an island that's very close to us here in Tonga. It's only about 7 minutes airplane ride to Ewa. So most of their staff, they're very short staff, but because they are closer to us here in the main island, most of their cases are being referred here. And it's also easy for us to mobilize from the main island to Ewa. But they're working very courageously in Ewa. Thank you. And this is the further island away from Tonga. There's a capacity of 10 beds, and there's 3 nurses in total. So these 3 nurses are doing all that they can. But it remains a hospital because it has a medical doctor with them. And just imagine when the doctor comes for leave or when he's out on doing anything, on official travel or on leave, the nurses will be taking up everything for the work in this island. And mind you, they are very far from us. So I think with God's grace, the nurses can still operate this hospital without a doctor in cases of emergency. Next slide. And this is Niwa Top Tapu, Niwa Fo'o. Niwa Fo'o is 6 hours boat ride from Niwa Top Tapu. It's a health center because it has 1 nurse and 1 health officer. A health officer is like a medical local trained here in Tonga. So almost the equivalent of an NP. So this population, they've got the 400 something population is taken care of by 1 nurse and 1 HO. Thank you. maybe have given you a little brief of our ministry structure and how nurses are operating from different settings. Making an impact for Tonga in education, we have finally upgraded our qualification from a diploma to a bachelor degree entry level for nurses. With that, it makes an impact on us because it broadens our scope of practice more with the bachelor's, and we can see the relevancy and the equivalent of having a bachelor in also with other Pacific Islanders and also New Zealand and Australia. So we are feeling good about ourselves that finally we have this and it's starting this year. So we'll see how it goes with us and the impact and the great impact that it will have in the nursing workforce. We are also upgrading our midwifery training from a diploma to a postgrad, which is a big jump for us. We are very short of midwife. We only got about 36 or 38 midwives. That's for the whole of Tonga. And it's not enough for us, but we're trying to get more nurses and a more broader scope for our midwives. We also are still going on with the push that 2025 we've got 25 trained emergency nurses, but here we're having acute critical care nurses, which we are hoping that all health facility and all wards will have a couple of acute critical care nurses because their scope is different from a general nurse. We're also lobbying for our nurse practitioner program to have it here in our own university, with the mindset that we will drum in a lot of midwifery and emergency, because our NPs will actually be the ones in the remote islands. So there'll be, as we are short staffed, and because of some limitation in our scope of practice, an NP will be the best qualified personnel to be by herself in the remote island. So we are pushing for this, and hopefully will also start next year for us here in Tonga. And lastly, with education, we're having the university, Rebecca and her team here with us, where Rebecca is training a few of our seniors here with us with project that actually will have an impact. These projects are issues coming up in different areas of nursing here in Tonga, and we are hoping, and we know it will happen, that when these staff are finished with Rebecca and Adam, we will have more recommendations and more impact for improvement for our nursing here in Tonga. But that's where we're heading, and I'm pretty sure the next cohort, Rebecca, will be including other health personnel and not just nurses, as our previous minister have mentioned to you. So I might be a little jealous there for taking you away, but hey, it's for the good of the people of Tonga. Thank you. Sorry, and the pictures on the slides, these are pictures of me joining in an island tour where nurses and a whole hospital is taken on a small boat to deliver services to the very remote island where there's no health center. So as you can see here, these are nurses doing dentistry work. So there was one dental officer coming in the island tour, but since there were nurses there, we all get to join in doing the Mali Mali program of teaching the kids how to brush their teeth. And these are the primary schools of the smaller islands. Thank you. With our jobs, pictures on the side, this is us. This is the medical doctor in blue. And this is how our hospital are being set up in the remote islands. And it's probably 3 islands. Mind you, it's like 3 boat rides, 3 hours between islands. And this is us So this is the doctor in front, and this is us at the back doing consult, doing observation, doing dispensary, and the nurse and the picture on the bottom. That's the ophthalmology nurse doing dispensary. That's how multi skills our nurses are. But with job, as you have seen that our number of nurses might be okay for you as you might interpret it, but for us here, we are still a bit struggling with our numbers. So our new minister, the son of one of our former head of section, is actually assisting us with lobbying government for more jobs. As we have 51 new students coming in a couple of months away. So we're trying to get as much so we can have our workforce in a less burned out situation. We are very focused on not very focused, but we are still pushing on having generalized nurses. So everyone who's coming, who's trained to be a nurse in a bachelor's degree and also in a diploma, has a lot of midwifery and obstetric component with them. So a general nurse completing at the end of her 3 years training is allowed to do obstetric work. She is endorsed to do antenatal, to deliver, and also do postnatal normal deliveries. And then she is, in her scope of practice, she is to refer when identified abnormalities. So it's always been a best thing for us. So when we have our nurses in the remote islands, we don't need to take another midwife. We don't need to have more people in the health centers because the general nurse can. She's allowed to do delivery. And now we are moving on to the NP. The scope will be better for us. Enhancing our NP career pathway, as I have chatted with Rebecca so many times, we are building this career pathway, and as the other division of the ministry is supporting us, so we are really focusing now on training. It's a priority for us to train more NP just because of our short staff, but their better scope of practice to be in the remote islands. We are also including ENT and ophthalmology nurse practitioner into our nursing cadre. Midwives, if it's not like in your country, but here in Tonga, our midwife must be general nurses. So, because if you are not working here in the main hospital, but you're working in a health centers, you have to do general nursing. So you cannot be just saying, I will not be doing this because my scope is just midwife. So it's still within our curriculum and our scope of practice that all midwife must be general nurses of more than 5 years. And this is something new for us, clinical governance, nursing research, and clinical educators. Not that I'm saying it's new, but we're having it now in our structure, and we are lobbying and we're assisting them as much as we can. So not only we need the practice, but we also need the educators and the researcher to assist us with improving our practices. Thank you. So with leadership, again, this is how we operate while we are out of the hospital. It's in town halls, in under the tree or somebody's veranda. So now we have included the NP and the APN in our nursing section, which they were under a section. Now we are pulling them out as an own individual one. And the reason why for doing that, because we are pushing now, the ministry is assisting us, is lobbying us that NPs lead and manage health centers. So probably very soon in the future, we'll be having NPs and nurses only in the health centers, which is a good thing for us. And it also boosts nurses morale that they're actually on leadership roles, on management roles in centers, in health centers. We're having a very young workforce. Most of our workforce now are either migrating or they're retiring. 60 years of age is our retiring age here in Tonga, with only 2 years of extension of services. So lots of attachment now from the islands, of us attaching our young leaders to the main islands, and also when we have the opportunity to take them overseas, just for the attachment of seeing how a leader and how to manage. We're developing and reviewing our strategic direction, and we are hooking it up to the government's framework, to the ministry's vision, and also to the WHO global strategic direction. Thank you. Okay, so service delivery. As I've mentioned before, that there are two, for the public health nursing out in the community, there are two sections, which is the sexual reproductive health and the NCD. And just last year, we have endorsed from our highest level of governance that these two community nursing merge, that they become one. It was like that before, and we did some work over the years and decided to have them on their own because NCD is a leading cause for death. And at the time, a couple of maternal deaths came up. So we thought to split them up and be very specific on their roles. But we believe with now that we don't need the very specificity of, and we are very short staffed. We need these two because they are working for the same population, same people. And because NCD is related to everything that's happening now, so there's a need for them to work together to see the relevancy and how things are connected. And here in Tonga, everyone is connected. The things that we do, even our culture has a very lots of determinants on NCD, and what better way to improve NCD than to start from an early age, from a mother's pregnancy and a child. So we are doing the merge, and hopefully in the next presentation, we will have these community nurses talking about the impact of this merge. We are also having the mental health awareness to be part of the community work. And it's really coming up now, mental health cases here in Tonga because of drugs related. So we really need not only the treatment in the hospital, we have to work on our community to make awareness, and especially here in our country where stigma is still very much strong. So that awareness is letting people know that it's not a bad thing, and to refer in time when people get to pick up signs and symptoms of someone before it actually becomes an unavoidable situation. Universal health coverage, where you see all these lots of pictures. With the merging of the public health nurses, it's one of a reason for merging, because as you have noticed that we have maternal and child clinics, and that clinic is there's a lot of them out in the community rather than the community health centers. So with the merging of the two, there'll be NCD services run in the maternal and the child health clinics, rather than just having the reproductive health. There'll also be NCD work related, and that's more of a scope of nurses' work to reach out everyone. They don't have to just find the health center or the main hospital. They can just go at any health center and clinic. And you can see the islands that the island tour that I have mentioned. Hawaii is actually having an island tour of of the hospital to take the services of the hospital, dentistry, laboratory, dispensary, nursing work, doctors, to the very remote. So it's a 1 or 2 weeks out in the ocean. That small boat where you saw in the first slide, nurses and the doctors and everyone are in this boat, and they're taking the services out to the remote islands. So there's no default for NCD from the islands. There's no default for immunization because actually the nurses and the doctors are coming up at every quarter. And it's sad for us because of our limited resources, because of our financial constraint. Excuse me. The the Ministry of Health does not own a ferry itself. So you imagine the nurse staying at her little quarter, and she has 5 or 6 islands to visit. So what nurses does, what the reproductive health does, NCD nurses does, what they do is that they just, whoever is coming is going out in their boat, probably they're going to the next island for church purposes, or probably just to do shopping. She will also hop in just to get there to do her work and then find her own way back. So this is her hopping on. If they're going at 4 o'clock in the morning, the nurse has to get on that boat because that's her only mean of transportation, apart from when the island tours are coming. So imagine if there is a labor woman in the help in any of these islands and the nurse is not there. So the nurse will have to go to reach her, or if possible, there is a boat there. She has to come to where the nurses are, but the nurse has to go there and then find her own way back. And that's how universal health coverage we're trying to get here, and to encourage the population that 1 month ahead of due date, please go to main island where services is available. But that's how we see, and even in the nurses in the clinical areas, we're doing health promotion and public health work, even they're in the even when they're in the hospital. We just launched a NCD in health emergency SOP for Tonga, which is a project that is funded by JICA, but because of the experiences that we got from COVID and our tsunami. So NCD will remain running even though there's a disaster or there's a health emergency going on. So not like COVID that we get to mobilize and centralize everything to the clinical. This time, nurses will know what their job will be, even in cases of health emergency. For Tonga, our main causes of death is NCD, all related NCD diseases, and also cancer, cervical cancer and breast cancer. And hence why I talk a lot on public health, because that's the work we are moving on to now, is mobilizing primary health care for nurses to do primary health care, so we can have the people have that awareness and let people know that there are services available for them. Here in Tonga, food, lifestyle is pretty much of our culture. Rebecca knows it. Here in Tonga, when you're here in Tonga, food are unhealthy food. It's like in our proper culture. So there's lots of foods everywhere. People exercise is not that much. So that's why we're merging the two public health nursing section outside, is to enhance that primary health care more now, so we can have lesson of them coming, as you all know, coming into the main hospital. With cervical cancer and breast cancer, we have it has been since COVID a campaign for HPV immunization. Mind you, after COVID, there were lots of NDVICs. But here in Tonga, before it was always 100% immunization. People were willing to for immunization, the routine immunization by public health nurses. We believe it was just after COVID, so many miscommunication in the social media, and some people are not all, but some people are still pushing on HPV. In the next presentation, if Rebecca still allows me to have my nurses in, they should be talking on the impact of and what they're going through with the immunization, HPV immunization program they're doing now. There's also a project from Australia that is being led by one of our obstetricians and the midwife of the cervical cancer screening, self-screening. So these nurses are actually, the midwives are actually out in the community in their own time to do to advocate and to educate and to give out the self-testing for the cervical screening. And that will be something also to be presented next time to see what are our numbers and what's coming out of those two work. But we have faith that God will lead us despite the lack of resources, despite our migration and other greener pasture from everywhere else. We will still have Tonga's health in our prayers and in our work, and hoping that we will still get the strength to continue and to push forward on doing nursing work here in the islands. And I think speaking on that, Rebecca, and because of context of smaller islands, Pacific islands, I think it's the challenges and the advantages is more or less probably the same for us here in the Pacific. Other than that, I salute the nurses. People are staying at home doing whatever they want and not wanting to come for immunization, and the nurses are actually just walking up and just being friendly, talking of the weather and what's going on, and then introduce HPV.
It's very true. We
Thank
know
you.
those nurses and they're incredible. Ellie, thank you so much for the presentation. I think it's really remarkable to see how nurses are creating universal coverage over so many islands without medical doctors, providing health coverage that otherwise doesn't exist. And so Grace, I will get back to you separately, but I think I don't know if anybody has any other questions. I just want to say that we've run over time, so if people need to go, I really appreciate your time today, and we're so grateful for you to come. But I think it's just been incredible to work with your team. I know Dr. Cooper is also here, who we've just really enjoyed partnering with the nurses in Tonga and seeing how the community health model is really so robust in Tonga, how there's door to door for the defaulters, folks that are not returning to their appointments, that are missing appointments, that there's really a vested interest in the health of their community. Our fellows are all working on different projects, one of which you talked about is this NCDs and lifestyle through our nurse practitioner. There's the HPV vaccine with Piola. Manu's working in the hospital on safety for medication administration. I mean, these are really, oh, Adam says malo pitu. So it's just incredible to see the level of nursing and how they're creating an impact around the country. And we're excited to hear some of them present on later time. And through your leadership, though, it's really an honor to see how nurses are really managing this global health system and working in your country and working with your team. It's amazing to see how the minister and the CEO truly do respect nursing and hold it very highly, and hold you very highly within their communities. I think it is such an important feature of what you guys are building. There is a question in the chat about where do nurses get trained? Is there a university? Do you want to speak a little bit about the National University?
Thank you very much. So there's a Tonga National University which was just recently, and nursing has moved from the Ministry of Health there. But normally the training of nurses were done by the Ministry of Health. So and all courses and all trainings were specific to what the cohorts were what the ministry wanted at the time. So in just I think 2023 that the merging of different education here in Tonga, and they move and develop our national university. And unfortunate, our nursing school had to move with them also. But that's where our training is, and some of our nurses are from overseas also. So it's not just local train, but our local training is done here by Tonga National University, and also there are other training from New Zealand, Australia, Fiji especially, because the nursing school has been there ages more than us.
And you previously in the Tongan Islands, there was only a diploma, and now there's going to be the bachelor's.
Yes,
But previously,
bachelor.
bachelor's and master's degrees, you had to go elsewhere.
We had to go to Fiji. If you have the money, you can take yourself to New Zealand or Australia or America. But through scholarship, Australian and New Zealand scholarship, they take us to Fiji National University for a bachelor degree, which is it's just a year bridging course from our diploma. But now we are starting this year of our own diploma, so there'll be no bachelor's, so there'll be no more diploma entry. We'll just start off with a bachelor's degree.
Congratulations. That's
Thank
huge
you.
for the team. One more comment, just I'm amazed and impressed at the scope of nursing practice. I benefited from this presentation. So thank you so much for everybody that joined. Thank you, Mele, for your time. I'm so
Thank
glad
you.
that we have
Thank you.
some later impact series to accommodate our colleagues in the Western
Yeah.
Pacific. I think it's really important that we hear your perspective and are so grateful for all that you shared. So thank you, everyone. I hope you have a most wonderful day, evening, middle of the night, and we look forward to seeing you next month. Thank you again, Millie.